So the benefit to having paediatric and neonatal expertise on the team is massive. Normally, ambulance crews don't often get exposed to critically ill paediatrics and newborns, and so bringing experience from that field and the expertise in the interventions and the medical knowledge that we require to provide expert care to that group of patients, I think is really valuable to the whole team. So when I went away to go and develop my skills in neonatal practice, I was really keen to bring that back to GWAAC and to share that with the team, because I think it's absolutely vital that we are able to treat all of our patients, regardless of how old they are, how big, how small. We should be able to manage them all the same and provide critical care to every patient that we attend. So I think in general, having a lot of exposure to critically unwell patients and the situations that they find themselves in is very protective. You know, there's only so much training you can do and so much simulation, but actually having exposure on a reasonably regular basis to patients like these then allows us to have the bandwidth and the mental capacity to not only care for these patients, but also their families and the situation they find themselves in. So clearly on the scene of any incident that we attend, our primary focus is on the patient and on their care needs, but particularly when it comes to paediatrics and neonates, it's absolutely essential that we don't forget the family members that are intrinsically involved in this situation as well. And so once we've got on top of our initial priorities with the patient, we'll absolutely try and send one member of our team to be with the family and explain what's happening and to make sure that they are appraised of the situation and the care that we're providing all the way through, to try and bring some sense of calm and understanding to the situation. So every patient that we attend has a life behind them and stories to tell, and it can be quite challenging, I think, at times when we're providing critical care to these patients, to try and remain impassive and removed from that and try to remain focused on the here and now, because that's what we're here to deal with. And I think sometimes when it comes to managing paediatrics and neonates, that challenge becomes even greater, to try and step away from the emotional aspect of the job, because you know, those little people have still got so much ahead of them, and I think that can bring an extra emotional burden. It can be very emotive, and it's a real challenge, I think, sometimes to try not to allow that to infiltrate your mind when you're focusing on the critical care that is essential in the here and the now.